Hello. How are you? Uh-oh, I can't hear you. Can you hear me? I'm gonna pause. All right. So I do just want to be conscious of everyone's time because I think probably in the funeral home industry, you guys are the busiest humans around. So we will go ahead and get started. As I mentioned, like the goal of this is definitely to be conversational. We have obviously some awesome experts who have been in the weeds in this and really are going to be able to speak to their experience. But we also definitely have a lot of other people that I see on the line that I know have a lot of experience in this space as well. So I definitely recommend there's a chat box. So if you want to, if Buddy says something that you definitely resonate with, like go to that chat box and write in if you feel the same or you feel different. If you have questions, you also can use that. And then I'll make sure to leave time at the end for Q&A and any other people's kind of feedback and responses. But I'll be monitoring the chat box throughout. So if you have a immediate question or immediate thing to add, just feel free to go in there and add something. But yeah, super excited to have this group. They're just really the experts in the business here. My name's Katie and I work at Eternova. We're a Memorial Diamond and Grief Wellness company, and we're based here in Austin, Texas. Really I would say our goal for this is to be able to just bring together a bunch of thought leaders who are really doing amazing things in the industry and to share and reflect and to think about how we all can really support one another. One thing that we really did to try to give back and help during this time was we ordered a bunch of N95 masks and sent them out to funeral homes. And we actually have a shipment of about 2,000 more coming in. So I'll post the link in here, but if you guys do need PPE supplies, that's been a big focus for us at Eternova to be able to help and send you guys masks. And we've been doing a few other things, but again, I think really the goal of today is to listen, to learn, to talk to people who have been in the weeds of it, and I'm just here to kind of help facilitate that conversation. So yeah, with that, I'm going to just go around and have each of our panelists introduce themselves, tell a little bit about where they are, their home, and maybe just really high level how COVID has impacted your funeral home. So I'm going to go in order of people I see here. So I'll start with Kevin.
Kevin Schettinger. Nice to see so many familiar faces joining the call. I would say the panel of experts is pretty much everyone on this call from what I can see. But Schettinger Funeral and Cremation Service, Columbus, Ohio. We have 15 locations, serve about 2,900 families a year, hopefully 3,000 this year. I've been fortunate enough to lead our company's COVID-19 response with, in conjunction with our HR director, and she's been great. And this has been a wonderful challenge, and something that I can talk to my grandkids about someday. Say there's this really crazy time when we had to make these decisions. I know talking to my father about some of the decisions we've had to make has just been very, very interesting. So it'll be interesting how we can document this as funeral service for future generations as for what they might see.
Yeah, for sure. Scott, you're next in line.
Hello, everybody. I'm the outsider. I'm with Greystone Associates. We do advisory services, talent development, do a lot of staff management training, operational focus, customer service metrics, financial metrics, and a lot of our customers, not a lot, but we have about 100 customers in North America and 2 in Asia. And so we've got a lot of exposure to the front line, what's happening all around. I would just say my observation over you can't really take the last 4 months and come to any general conclusion about what happened. And the reason I say that is I see people in New York on this phone, on this Zoom call. What they went through with Frank Carmen was incredibly different than what a funeral home in Idaho might have gone through. So I would say that, the generalization is what's unbelievable what I saw in terms of how different funeral homes had to adapt to what was happening based on exactly what was happening in their market, not what was happening across the country. And the trends and the generalizations were incredibly micro-focused, and it was very operationally intensive, very staffing intensive. And I'll tell you, based upon the data we look at, every one of the last 4 months has been very different than the prior month. So it's just been a real evolution, a real balancing act, I would say kudos to everybody we work with in terms of how fast they adapted and how fast they changed. It was really amazing. It was amazing to watch it. So looking forward to contribute any way I can on this call.
Awesome. And yeah, Scott, I think your perspective kind of across the country is what is so valuable. And, if you look at our panelists, I think what's exciting is we kind of have every geography here really mapped out, I guess minus the West Coast, but I know, Scott, you have clients on the West Coast. So definitely a good amount of different perspectives based on number of COVID cases, geographies, all of that stuff.
Yep, agreed.
Cool. Buddy, you're next in line.
Hi, folks. I'm Buddy Seneff. In New Hampshire, we operate about 7 funeral homes, doing a little over 3,000 calls a year through our full-service funeral homes, and we also operate a discount cremation firm. We certainly haven't done the volume as you have. We saw, I think, to date about 150 COVID families, but that's about a third of all the COVID deaths in New Hampshire. So as a result, we've sort of been the point firm with other firms calling state associations, health organizations, how are we handling this? So we've gotten a lot of feedback in our relationships and work with our state officials on this. So we have sort of interesting perspective on that. One of the things that we did early on, and I certainly can share what we've learned, and I'd like to hear what you've learned, is I had tasked my staff with saying, what are the unintended consequences of this, good or bad? So let's start keeping track of those things because of, we had the same issue. Unfortunately, New Hampshire had a very bad opioid problem, and we never really tracked that. And thank God that's resolved itself a little bit more with this. But we've sort of learned from our mistakes in the past and saying, let's look at this horrible thing and see what, best practices, what we can learn, things we didn't realize, and how we can better use this to be a better performing, process-oriented company.
Yeah. And I think that's really the goal of today is like, what are the things we can take forward? What are the lessons learned and how will that affect the industry, for the future? Cool. Chia, you're next in line. Oh, you got to unmute yourself.
Sorry. I'm Chia Wolschlager. Nice to be here today. Thank you for the invitation. I'm representing Purchase Funeral Homes, and I basically came on board through my master's program. I asked Mr. Purchase, who is my boyfriend, Salvador, if I could use Purchase as my case study. So it has been truly a phenomenal company to be able to use as an experiment in all of this. Purchase is very unique as well. I don't know if you all know that we actually are in 3 different states and in 2 different countries. So the challenges that Purchase has is not only just in El Paso, but we also have the challenges of Mexico. And right now with the COVID going on, this is a huge challenge. So Purchase is very bicultural in the way that we have to manage everything, marketing, just in every aspect, really. It's very bicultural. And I think you said it best, Katie, when you asked the question, how do you have to think outside the box? And I believe this has forced us to absolutely have to think outside the box in every single aspect of our company right now at Purchase.
Yeah, and I definitely want to dive into like some of those specific examples because I think that's what's going to really help folks as well. Cool. And Frank?
So my name's Frank Carmen. I'm with Carmen Funeral Home in North Central Connecticut. We have 9 locations, and we had pretty rapid, dramatic change in our business during the coronavirus epidemic and pandemic in our area. We got a phone call from a nursing home that they had 70 confirmed cases in our town. Didn't really know how that would play out, and ended up that they had over 100 deaths over the next 30 days just in that one nursing home. We're in small communities. Most of our communities are under 30,000 people. Some of them are as small as only 1,500. And we've handled over 400 coronavirus deaths at this point, where it was confirmed coronavirus on the death certificate. We do operate 3 crematoriums, so we ended up helping a lot of our colleagues in New York City, and handled about 400 cremations for outside funeral homes, which is kind of outside of the norm for us. We typically only do our own cremations. So we were helping a lot of our colleagues in New York City as well. But it was a unique time. We did get a lot of phone calls from families in New York. We ended up serving probably about 20, 30 families that had called us and just expanded their search. We're about 2.5 hours north of New York City. So we did have some families that said they contacted, 20, 30, 40 funeral homes, and were just told that no one would help them. So as they expanded their search, they found us. And, some of these were house call deaths where someone had died at the home. And we went all the way to New York City for just to help families where they couldn't get help from anyone locally.
Yeah, Frank, I think your perspective here is just going to be so fascinating. And I remember, I think I reached out to you like right in the middle of it, and you were like, literally the only hour I have available is 11 p.m. to midnight. That's like the 1 hour that I have in my day. And I mean, my mind was blown. And I think your stories and what you saw on the front lines are just, it's so important that we document that and also learn everything that you did to really be able to help families. Cool. So I'm going to do this instead of like going in a line. I really want people to just jump in so that it does become more conversational. But I am really curious, like in terms of your guys' biggest challenges and concerns. I think you all kind of hinted at some of them, but I think it's really different for each of you, whether it's volume or staffing or any of that. So I'd love to just kind of hear from each person, like, what was the number one biggest challenge that you really faced, or Scott, that you saw funeral homes face when it came to COVID? And I'll let whoever wants to start just jump in and take it.
I'll start. I would say, across North America, we have 11 customers in Canada, as I said. I would say without a question, the number one concern they had was how do they keep their staff safe? Not only for their own well-being, but it's hard. You can't run a funeral home without people, and so it was number one concern was keeping staff safe and doing it in a way that they could still operate their business. So we got involved in tons of conversations around split schedules and staffing schedules and staff separation, and how do you still run a business when you only have half the people in the building. And by far and away, I would say that was number one. After the initial shell shock of crowd restrictions set in, and oh my God, how am I going to run a funeral home if I can't have services? That actually lasted about a day. And then I went right into how do I protect my staff? And that was for 2 weeks, all we seemed to talk about with customers. And I don't have the final stats, but interestingly enough, our customers employ about 3,500 people. And I can tell you, I'm aware of less than 5 people that got sick from COVID over the last 4 months. So I think people did a really, really good job, keeping their staff safe, extra safeguards with PPE, transfers, the whole 9 yards. So tons of time spent on the staffing model, no doubt about it.
Something we heard.
I'm sorry, Katie.
No. Go ahead.
I was going to say, that was our first concern with staffing. Luckily, our cremation society, which has been e-commerce for 20 years, so we were already making arrangements and have continued to make arrangements online. Is really the only way of doing it. But working from home, one of the interesting things we found is that I was always reluctant to have staff work from home, even though we had the technology. Everything we use is in the cloud. Our phone system has an app where you can actually answer your cell phone, and it gives you the appearance of being sitting at your desk. So we had the technology in place. I just was reluctant to let staff work from home because, they're going to goof off and they're not going to be efficient. What we found, though, after about 2 months is that the average number of hours that my employees work from home, these are mostly the funeral directors, was about 20% less. You know, we were upfront and saying, hey, listen, if you got to go walk the dog, go pick up one of your kids, run to the grocery store, meet the cleaning person, whatever, that's fine. You know, want you to be clocked in. We pay everyone hourly. And with our increase, had about 20 to 25% increase in volume. So what we found out at the end of this, when we stopped tracking it, is that employees, funeral directors, mainly logged in about 20% less hours, yet saw about 20 to 25% more families, which sort of was an interesting dynamic and saying, okay, you know, because if someone's at work, they may be clocked in, they may not be busy, but they're shopping on eBay or doing this or doing at their home. So now we're re-looking at this. Again, that's sort of one of those unintended consequences. Maybe, you know, maybe our staffing model going forward is a little bit more flexible in terms of people working from home, because we've already shown they can be as much, if not as more efficient without necessarily logging in extra overtime. So that was sort of one of the interesting takeaways that we came across.
A lot of people found that, absolutely.
Yeah, and I am curious, just in terms of digital arrangements versus in person, like how, you know, how much of it were people still coming in, or how much of it was now being done online versus, you know, I think before almost everything was pretty in person.
And I know for us, we, like Buddy, we had a lot of tools in place, but they were mostly for our value brand. So we have our Schettinger Funeral Homes, we've got Heart and Hope by Schettinger Funeral Homes, and we've got Buckeye Cremation by Schettinger. And so our value brands were very, very just on top of it. We already had documents set up for digital signatures. We had, you know, used to online phone arrangements for them, but then training all of our staff on those tools for our main company and getting everyone up to speed. That was the huge hurdle for us. First step, how is everyone going to be safe? Number one concern. But once we got past that, it's okay, how are we going to actually deliver?
Correct.
And so that was what tools do we need to build and develop in a very short period of time to get our staff up and running so that they can make those arrangements from home. So that was getting our company up and running on Microsoft Teams. That was creating digital documents. That was creating our digital arrangement software with Eternova. Thank you, Katie. That was a huge help for us. Creating new packages for our families that made much more sense for COVID-19 social distancing. That was our webcasting technology was extremely dated, and we hadn't really addressed it because nobody ever really used it. So it was okay, now we got to upgrade the software on that. We had to get that really up and running, because our first thought was, okay, we're offering complimentary webcasting. How can we get these tools in everyone's hands? I would say Microsoft Teams was probably the biggest key to all of that, because we could actually have meetings and do trainings and record it. And so people can go back and watch the videos of the trainings and make sure that they're on top of that. So that was the big hurdle. It was just, okay, writing new policies and procedures every day, sending out trainings every day, doing a morning update. Hey, here's what's new today, sending that out every day. So that was the big things for us. And then eventually, once we got all that, it's okay, how do we start recouping some of this revenue?
Right.
For the revenue shortfalls.
Correct.
But yeah, number one, how we keep everyone safe. Number two, how are we going to get the tools in our team's hands to make this work? And number three, okay, how can we start recouping some of the revenue?
Frank, Chia, I'm really interested, especially, I think, Frank, some of your concerns might have been a little bit.
Our staff, we were very concerned for their safety, obviously, first and foremost. We had a lot of meetings. Connecticut's a little behind most states in that we still have a paper death certificate that we type on typewriters. So when we got these huge increases in volume, and we're trying to get our typewriters repaired because they're burning up from typing all these death certificates. And, a lot of our older staff that help us in running these death certificates to doctors' offices to be signed and all these different things, they were like, we're not coming in anymore. my spouse doesn't want me here anymore, or I just don't feel safe at work anymore. So we ended up having to depend more and more on our funeral directors. We do have a couple of our funeral homes are majority minority funeral homes that are still very traditional in many of their services, and still wanted to have services at their church or at our funeral home, still wanted to have open casket visitations. So we still had services, viewings, and funerals right through that entire period where we were having a huge surge in COVID deaths. Scheduling was an issue, doing online arrangements was an issue, and then beefing up our web streaming, which we've done for 15 years, and creating a new platform where we could do more services outdoors, and having web streaming in churches and at gravesides. And we were able to do all that, which we were fortunate. And that really set us apart in many ways, because a lot of families were not able to do that. A lot of other funeral homes were just having services outdoors in their parking lots and doing drive-by wakes. And we did that for a few families that wanted it, but most of the time we were able to have services in our facilities. The big key for us was having I would say probably twice a week. We were doing about Tuesdays and Thursdays every week. We were having meetings. So our monthly meetings became bi-weekly, and we were updating people on the governor's orders. We were updating people constantly on the number of people that could be at a funeral. We had open discussions about some of the challenges funeral directors faced, and then some of the fears they had. We did have 2 funeral directors contract COVID-19 from families. And, you know, that was just a huge fear for the first funeral director that got it. She wasn't feeling well, went, had a test, and then called me in tears that she had it. And then it was like, all right, is our whole staff going to get this? We're, you know, unprecedented, busy situation. And am I going to have nobody working here to even handle and care for all these families? We were not able to have split shifts or anything, so everybody was working. She contracted it from a family, and it was just a miracle nobody else got it. 3 weeks later, another funeral director wasn't feeling well, got tested, and he tested positive as well. So we just had to reassure our staff. We had as many of them that wanted to get tested right away. We did do our best to sanitize the funeral home. We had some of those hospital grade bombs that you release overnight in the funeral home that are supposedly kill all of the virus. And we had those, especially in those areas where they worked. And then tried to totally sanitize the cars that those people rode in, tried to go back and do any sort of contact tracing and have the people that they were working with the last several days be apart from everyone else. And then in our biweekly meetings discussing plans, what happens if this whole location, the whole staff there gets COVID-19. But from the very beginning, we broke up our break rooms. We broke up where people ate. We broke up even our restrooms, things like that, so that people were not together at all. And fortunately, although 2 of our staff members contracted COVID-19, it wasn't from each other, and nobody else contracted the virus from them on our whole staff, which was great.
Wow. Frank, I think when you said the numbers that you said, like my mouth dropped. Like, I mean, in terms of just that amount of families and how many people you were serving, like, I mean, it sounds like people were just working around the clock, but like, how did you handle that amount of families and being able to like actually deliver and serve that amount of people?
Well, we have 25 funeral directors. They were all seeing anywhere from 15 to 25 families a piece at a time. You know, we were doing our best and just letting families know up front when they called, this is the situation we're in, this is the time we have to meet you. And, you know, we weren't offering the service that we're typically known for, and just letting people know at the outset, we're not able to provide the service that we want to, and just trying to communicate with families right out of the gate. Another thing was we needed more space for the bodies of all the families we were serving. We had a lot of our cemeteries that were closed initially, and then, you know, we can't schedule a burial for 4 weeks, so we were getting more and more backed up. So our builder, who we've worked with for over 30 years, built a new cooler for us that had a capacity of an additional 150 spaces. And that was key. He was able to do that in 48 hours. And, that was up and running, and that did a lot to help reduce the feeling of just pure chaos around the funeral home and not having all these people out. And then there was a lot of training amongst our preparation staff, which is 10 individuals, and making sure that we were following identifications very, very closely, because it's always a little scary when you're caring for, 250 families at one time.
Yeah, for sure. Yeah, well, again, like the ability to adapt quickly and figure out solutions is just mind-boggling and pretty amazing on your part. Chia, tell us about in El Paso and in Mexico as well. What were some of the biggest concerns?
Well, I mean, unspokenly, safety was primary, but then we also moved into the fact that we are on the border and we have a very Hispanic Catholic culture. And so the immediate panic begins with the families and how are you going to do this? And so being on the border, it was also educating our community as to what live streaming is, what we can do on the computer, how we send e-documents. So that became a huge challenge for everybody, I think, in the whole community. We did create beautiful drive-through funeral areas, and Sal converted what used to be where the hearses were, the garages, they were all converted into beautiful chapels. So we created that, which seemed to put people at ease, because instead of turning them away and saying, no, absolutely no, we were able to give them an option and say, yes, this is how we're going to do it, which created a lot of calm in the city. We also we have an RV mobile office that we used to go to the families. So we really promoted the RV mobile office so that people wouldn't have to leave, because everybody was paralyzed through the beginning of all of this. So we would go to you instead of you coming to us, which also helped in our culture too, to be able to ease a lot of these fears and be able to accomplish what we needed to do with all the families. And, we are servicing about 4,500 families. So it was a little chaotic, but all these things implemented seem to help ease the fear of everybody. And our poor sister city, which is Juarez, Mexico, was impacted horribly. And the borders shut down. The international borders, as you know, shut down. And then we all of a sudden have bodies that need to be brought back and forth. So logistics became also another challenge as to how to do the transfers from Mexico and the US now. They were hit really hard. Sal lost two of his directors last week to COVID, and their regulations are not like the US. I'm sorry to say that they really don't care over there like we do. So they're being hit really hard. So we've got all those challenges being on the border right now too. But I think it's forcing us to think outside the box immensely, step it up for our families and for our employees. And yes, like Frank had mentioned, the fear of our mass exodus of our employees. Once somebody gets contracted, how do you come together as a team and just fortify your company so that everybody can kind of muster through these hard times? I think that is huge right now, especially right now, still seeing the trickle effect of trying to keep them safe and somebody getting diagnosed, and the fears that run with that right now is something we're facing as we move through this.
Question for Chia and Frank. As funeral home owners that serve very traditional, very religious communities that really show up for funerals, how are you handling large services? How are you handling making sure people are wearing masks? How are you handling all of the logistics that go around having those traditional services? That is the biggest struggle that we're running into right now is, okay, we're trying to limit capacity inside our buildings and that sort of thing to accommodate. And, we do have families that want to have large gatherings, but you know, I don't necessarily feel safe for our staff and for the people that are coming doing so. I'm eternally grateful that our county just mandated masks so we don't have to keep having that fight with families or our guests. But I'm really curious how you're handling those traditional communities that really show up and turn out for services and just handling those large crowds.
We offer masks. We have hand sanitizer there. We offer to sign the guest book for families if they still want a guest book. Many families, again, very traditional, want a guest book, want printed materials. Our governor has limited the amount of people that could be at a funeral. We were at 49 and now we're at 100. And depending on the size of our facility, you can have no more than 50% capacity. So some of our chapels do seat less than 200 people. So we're sometimes even under that number. And people are very understanding here in Connecticut, I would say, that you have to wear a mask. I mean, that is part of the governor's orders. So pretty much everyone has a mask already. There are a few that don't, and we always have some on hand. They're readily available everywhere here in Connecticut now. They weren't earlier, so that was a little bit of a problem. The other thing is, you know, we've just told people as the funeral home got to capacity that people would have to wait outside and come back. We also extended visitations. So we did have several visitations that were 4, 5, and even 6 hours so that they could have more people come through. I will say there is less people coming to funerals. Even families that I know would typically have a lot more. The service sizes are much smaller. They just are. People are scared to come out.
And they're not staying as long. And so it's easier to manage the crowd size to some extent.
Exactly. And people are very cooperative, we found.
Absolutely.
For the most part. We've had a few younger deaths. I had 2 young men die in a car accident. And, you know, that was very difficult. It was a double funeral for both of them. And it was just extremely difficult with the amount of young people to keep to the numbers. But other than that and a few other circumstances, we were able to do that pretty successfully.
We were tested about a month ago with the national coverage of the 23rd victim from the Walmart shooting just died a month ago. And so it got national coverage. So once that happens, then we've got like CNN down here and everybody. So that tested everything that we did. So we had to do like the LED screens outside of the funeral home. We've been very lucky that our mayor has been very strict from the very beginning about face coverings, face shields. Our numbers go up and down. We were at 50, we're back to 10, but we allow, you know, a constant flow, timing flow. Everybody had to enforce the 6 foot, but it was the biggest challenge we've had, and being able to really instill the live streaming, social distancing, the drive-through. We really had to utilize every single asset that we had for that type of a funeral. Also, because families still gather and they're mourning because they need the closure from that event a year ago, and they still are, you know, in mourning. So that, yeah, it's been very difficult.
Yeah, that makes me think of just, you know, there's going to be a lot of post-grief after all of this. And so I'm just, you know, we know that gathering is how people come together and how people really are able to feel some sense of closure after a loss. And so just curious your perspective on the grief side, like, you know, how are families grieving right now? And what do you expect to kind of see, or what are some of the things you've done to help them be able to grieve more effectively when they don't have their typical grieving rituals?
I can't address how they're going to grieve, but one of the things that we're doing later this fall is we're actually hosting a webinar, an insight, a delayed grief seminar, whether it be our families or really anyone. We're having a couple experts come in Zoom meeting and just talking about the impact of delayed grief, because we're not necessarily the experts in terms of, you know, psychologists and sociologists, but they are. So we're trying to provide that resource to, you know, to our communities.
And we've seen those customers of ours that do have grief counselors on staff or aftercare programs. They've had, on average, a 2-fold increase in requests for group support or individual meetings. So there has been a really large jump in request for aftercare services. And, when you read, feedback from families, it's very clear that as hard as the funeral home tried to accommodate the needs and the wishes and the wants, they just in many cases weren't able to have the experience they wanted. And in some cases, probably not the closure that they wanted. And so I think there's going to be a significant opportunity if you have aftercare services as part of your funeral home to really promote the value of aftercare and grief support. There's no doubt about it.
Yeah.
Yeah,
go for it.
I was gonna say, we've when all this started, we said anybody that has a service now, like a small private service, will offer a service in the future when we can all gather together again. And our hope is okay, well, at least we can do something now, and then you can come back to our facility in the future, and we'll when everyone can gather, and we'll give that second opportunity. And what's becoming more and more clear to us is we don't know when that's going to be. I mean, our initial hope was, okay, we should be able to get these done in the fall and be able to maybe knock them out before the end of the year. And it's looking more and more like we don't know when that is going to be. And so we're trying to take a look internally, and are we ever going to be well, I would say, how long is it going to be before people will just say, you know what, screw it, I'm not doing it anymore.
Correct.
And so we do have some people that have taken us up on it. It's been actually a surprisingly small amount. But yeah, it's definitely a real concern. Is, what's the one thing you want more than anything when you're grieving? You want a hug, and we can't even have a hug right now. Right. Well, I would say plenty of people are, and that's part of the challenges that we're going through. Is, you can't stop people from hugging. You can't stop people from having that contact, which they so desperately want, even though we're not supposed to. And so that was why I was really curious how our even more affected areas that have larger gatherings, how to handle that, because I know that's the biggest challenge for us, is having those, like, being the mask police, going around, can you please make sure it's covering your nose, or and having those difficult conversations. I know I am sick and tired of talking to my staff every single day saying, people have to wear masks, you have to wear masks, people have to wear masks. If they're not wearing a mask, you gotta go talk to them about it. And so I'll shut up now, but that was really the thing that we wanted to try to do, was let's try to offer that future time. And that seemed like a great idea at the time, and I just don't know how effective it's going to be.
Kevin, you mentioned about delayed services. That's really one of our concerns. We have a delayed service tracker, a spreadsheet. You don't know what you don't know. I think we're tracking 98 or so, 95 delayed services, which is great to know. But how the heck are we going to staff 98 additional services above and beyond the regular services that we're serving? We've hired some part-time funeral directors from smaller firms. We've had a couple small funeral homes that basically closed up shop and said, we're out. We just don't have the staff. If one of us gets sick, we're closing down. So we've been hiring some of their part-time directors to help us. I think the other day we had 11 services at one of our locations, and that's we don't know what we don't know in terms of how we're gonna deal with all this.
What are some of the other ways you are I think there's no end date, right? So it makes it so difficult to be like, by this date we could plan a funeral, and we know that we'll be able to do that, which must be super, super challenging. What are some of the other opportunities or things that you guys have done to bring in revenue now that's not about gathering, or provide value now that is not just a service?
One of the ways we generate more revenue is got that PPP money.
Yeah.
And related to that, I'm sure you're all doing creative things. One of the things that we did, some of this was because it was the right thing to do, but some of this was self-serving, is we realized that our staff was not going to be able to take vacation time just to sit home. So we allowed them to cash in up to 3 weeks, which we normally don't do, within a certain time period. And we also gave out some pretty significant hero bonuses for those people that could not work from home. our transfer people. And we made sure, I mean, again, right thing, but we made sure we did that within the PPP timeframe, which certainly boosted up significantly our payroll for those periods compared to the periods, the tracking period that we submitted. So A is the right thing to do, and B, it certainly is gonna go a long way to help make sure that we can get those funds forgiven.
Katie, I would just say from a data standpoint, from analyzing our customer base, April was by far the low point in terms of revenue, just because that was the strictest of the shutdown period. We saw in May about a 10% uptick in all-in revenue per call. And so far for what we see in June, this may sound a little callous to say this, but if you didn't know COVID was going on, and if you looked at the data that you looked at from the funeral homes we work with, you wouldn't have any idea that it's happening. Service revenue, merchandise revenue, overall call mix, it's shockingly normal. So whatever everybody's doing it's working. Revenue has been very, very consistent on the rebound for 2 months in a row.
Yeah.
We just sold $40,000 in the turn of a diamonds last week. So
wow.
Plug for Katie.
No, but I mean, I think we are seeing that people are leaning into experiences they can have digitally, right? Like we're seeing like the Zoom memorial services are a great example of some of the innovations. And then I do think like, memorial options that people can have with them, like a Eternova, like Thumbies, like something that somebody can take away and say, I still feel like I have this person close to me, even if I, wasn't able to do my typical grieving ritual. Our average order value at Eternova has gone way up and revenue has gone way up. And I think it is because people are leaning into having something they could do right now, but then also this like digital journey. So it's been interesting. But yeah, so in terms of some of the other innovations, like you guys acted very fast and came up with innovations. Like Kevin, we built that tool. Like there are so many things that were happening. Like, are there any other innovations that, I think are going to be here to stay that COVID really caused you to put the pedal to the metal on?
If you didn't have digital signature documents, you probably have them now. I think that's going to be something that's going to stick around. I think video conferencing, the idea of having Zoom meetings, just if anybody has more than one roof, how much does it make sense to have all of our staff all drive, get in a car and go to one spot and have meetings? The idea of having monthly meetings when you can do, or, we'll do an in-person training when you can do a training on Teams, when you can record it and have that video available for people to review instead of just doing a one-time training. I think that those are the things that are really going to stick with us is how we communicate, how we do messaging to our staff, how we, just how we train for everything. I think that is the things that will probably stick with us more than anything we've done for our families. It's how we've had to operate internally, which is really going to stick with us.
I think one of the things is from a consumer standpoint, I think really this is going to cause a pretty significant paradigm shift in what consumers expect from funeral homes, in terms of safety, in terms of, for example, making arrangements. Fast forward a few years from, well, when mom died, we didn't have to come in. We made arrangements online, over the phone. Why do we have to come in now for dad? Or, we really scaled down services. We delayed. We thought it was an issue at the time, but, none of us are in grief counseling. We all seem to come through this. Maybe we're going to do the same thing for dad. I just think from a consumer standpoint, it's really going to shift what a funeral is, what it does, the expectations, what were they expecting us to do in terms of the technology, in terms of the cleaner rooms, in terms of the social distancing. I just think it's gonna be around, and it's gonna impact our industry more than we think.
So to that point, buddy, and everybody on this panel knows that bonding, relationship building, empathetic, emotional connectivity with families is what drives value, right? It's hugely important to be able to build relationships with families, and video conferencing is great for arrangement conferences, but it can't replace the relationship that arrangers trying to build with that family. And so to that extent, the more that technology is used, the harder your staff has to work to build those relationships to continue to deliver value. It's not an either or, it's a both.
Yeah, Frank Chi, I'm curious from your perspective, like what are some of the things that you think might be here to stay?
I would definitely say the video conferencing. I think more and more people are going to want to be able to attend services virtually. We've been web streaming every funeral unless a family explicitly did not want it since March. And we have a number of people logging into services. Many services had over 100 people watching. We've also been helping a lot of our local churches web stream their services to keep in touch with their own congregations. And we've also been hosting 2 churches a week at our funeral homes because they're in facilities where they were not able to have services. And both of them are just web streaming services just to keep in touch with their congregations. So that's been good for us. As far as the revenue side, as Scott said, we didn't see a huge shift, but we encouraged all of our families to have funerals because the backlog was getting to be too great. And we didn't know when it was going to stop, and there just appeared to be no end in sight. And there still doesn't appear to be an end. And the few families we had that delayed, some of them we've had to reach out to, especially if families that chose cremation, they're starting to say, hey, everybody was together for the 4th of July barbecue. Yeah, why don't you just give us a refund for that memorial service? So we did our best to encourage families to have services right after the death and not to delay. And I think looking now in hindsight, that was definitely the right move. The other thing is for families that were having services and they had to be private, we were leveraging our graphics area, and we were having our graphic designers make very custom invitations, and we were getting Christmas card lists from families, and then we were doing mail merges and mailing out custom invitations to people. So instead of people reading about the funeral in an obituary, they were getting a customized personal invitation to come to a private memorial service. And a lot of families liked that and actually preferred it, and it gave us a little bit of revenue on our side as well.
I'm interested to see, as you probably all know, the FTC is now re-examining the funeral rule, and one of the issues is should funeral homes have pricing online. We've had pricing online since there's ever been an internet, so it's not an issue. But I know for a fact during COVID, we've had a lot more families shopping, looking at funeral homes, not wanting to go in. And most of our competitors don't put pricing online. And I know we've won a few shopper calls because we did have our pricing online, and families didn't want to come in. So challenging to make arrangements if you don't actually can see the funeral home's website. I'm just wondering how much is this going to play into the FTC requirement to put pricing online with COVID? It may not impact it at all, but I'm sure there's going to be some consumers chiming in and saying how much more challenging it was with COVID not coming in. My funeral home didn't give me prices. Maybe they didn't have their brochure as a PDF. They had to mail it or fax it. Just curious. Don't know.
Scott, I feel like you might know that best.
You said me?
I said, yeah, you might know it best. You probably talked to most
I'm not an FTC expert.
Yeah.
Yeah.
I'm going to back out of that one.
Okay.
I'm sure that they're required
rhetorical. It wasn't actually
prices online.
Yeah. I've always been a believer that you should have them posted just for transparency reasons.
Correct.
I think there's a lot of people that won't even give you a shot if they can't even find your pricing.
Yeah, and I think, Buddy, to your point, like families are going to try to be more self-serving up front. They're still going to want to have a human connection long term, but like at least in that, top front research of going to the internet, Googling, they're probably going to feel a little bit more self-serving because they've had to be in this time to some degree. All right. Go for
budgeting.
it.
I think people are watching their budgets really carefully right now. And so they are shopping it out. And so it's helped us a lot with revenue to be able to create packages to meet the budget needs for people right now. And I think that's been really important. And it's also, I think that's how I reached out to you, is being able to offer a lot more tools, I think, for our pre-need agents as well. We have about 60 agents active right now. and telesales became huge. And so we needed to be able to create more selling tools. And that was kind of what we revamped 100% in this downtime. So we started YouTube channels, educating the community or the country on everything, because I think there's a sensitivity right now in the country as to what a funeral is and what the needs are and what your pricing is and your costing, and the whole entire death conversation, I think, is extremely sensitive right now in a positive way for us in reality. And so we've taken a lot of this downtime to create YouTube educational videos on why and all the things people don't know about our industry has been really important to me. And so in that, I think being able to arm our people with great selling tools for additional revenue, I think has been really important as well.
Chia, I'm right there with you about creating new marketing tools. I know we created all new, totally unique packages just for social distancing, and built them around, okay, what are the things that we're limited by? What are the things that we can offer? I'm really glad we spent some time out at Frank's place learning about his print shop too, because we had got ours up and rolling just before that. And I can't even fathom what we would have done without our graphic designer and being able to create packages, creating specific printed goods where we can send out letters to everybody and have them write a memory back with pre-printed envelopes to the family to try to keep those people engaged. And so that has been the biggest benefit for us, was having that graphic design team to be able to create new packages, to be able to create new things that we can put in front of families digitally to be able to serve them better. Curious how many people on the panel actually put together totally unique packages just for what's going on with COVID-19 right now.
Yeah.
We did not.
We're about a third of our customers did. It wasn't a lot. It was about a third would be my guess.
Yeah.
Yeah, we did. We're at such a high cremation rate, almost 76%, 85% in some of our markets. And direct cremation is such a plug and play that we didn't really feel the need to create any short-term packages for that. I mean, we were creative in terms of some of our pricing and discounts and delayed services, but giving away live streaming, for example, for a short period of time if people follow certain requirements, but we did not do that.
Okay.
Same here.
Frank, I don't think you had time.
Yeah, exactly. I was going to say the same thing. Cool. Well, I do want to be mindful of time and open it up to Q&A. So we have a good amount of people on the line. All you got to do is come off mute. If you have a question for a specific person, feel free to ask that person. If it's a more general question, go ahead and ask it, and whoever is brave enough will jump in with their answer. This is always the awkward part with Zoom calls, if people will actually come off mute.
You're up for the challenge, Katie.
Hi, y'all. Lisa Bowie here. It's occurred to me, and I've heard different theories from others, that will the lack of personal being together, having the hugs, cause people to go in a different direction, maybe back to wanting more services where they can be present after COVID, versus the opposite, that some of the statistics are showing people will do increased cremation with memorial service, but will they want to be together more because they haven't been able to, versus, and this is a future prediction, versus will they move away from it? What are your thoughts?
Lisa, I'm shocked you're the first one to ask.
I think we all are.
Thanks. On my mind. You have been too.
I mean, we're seeing this with the churches. So we're doing this live streaming for churches every week. Do 2 Catholic churches. We go to the church. There's nobody in the church except an organist and a priest. And there's 450 people watching Mass. And they're saying to me, we don't have 450 people come to church. have two predominantly African-American congregations using our funeral homes to have their services because they're in schools and the school buildings are closed by the state. So they're not allowed to use the building at all. So they were out of a building. So they're using our facilities with, larger music and programs and things like that and live streaming. And their congregations are what they've always been as far as attendance. And they're predicting that more people are going to come in the future because they've engaged more people, and people whose church was doing nothing, they wanted something. So they were actually attracting more people. Again, it's going to be very different, but I think only time will tell as to how that'll play out with funerals. Most of our families, because we were having wakes and things, they were very happy.
Correct.
And we did a lot of things to keep people engaged. We did some sort of Zoom meetings, things like that. We did mostly pre-recorded eulogies and tributes for people that couldn't be there at the funeral, and then played them up on our video screens during the services, and that worked well. But we're very hopeful that people will go back and want to have what they've not been able to have for the last several months.
Well, if June is any indication, people want services. It's an unbelievable rebound just in 1 month. Things are open, but who knows? Time will tell. But June is very optimistic.
I think people that want to find the excuse not to have services in the future will find that excuse. And I think the people that value interaction and that sort of thing are going to find reinforcement from this.
Right.
I don't know if that's going to necessarily, I think just wherever you're predisposed to go is probably where you're going to go.
May I ask a question to the panel in general? It's Corrine from INEX in Canada, and we provide tools and support to help the families settle the estate, deal with all the administrivia after the funeral. Are families still asking questions and seeking assistance, not from an aftercare perspective in terms of grief support, but the nuts and bolts and the logistics? Are families still concerned about the timelines and the deadlines and the taxes and dealing with settling the estate? And are any of the funeral homes or any of the panel seeing that as an additional opportunity to connect with the family, build the relationship, provide the added value? Are those tools being requested?
We created an ebook a couple years ago about exactly that thing that you're talking about, and we send it off to all of our families automatically after we've served them. And we've developed a relationship with a couple attorneys in different markets.
Mm-hmm.
We're certainly not getting any kickbacks or anything, but it's a referral service. It's a networking thing. I'm not sure we've gotten any more or any less. In the two states that we operate, New Hampshire and Vermont, everything is done online anyway through probate. So it's really, to me, not had an impact because the process is still the same.
I know that Canada has a lot more involved process in terms of aftercare and probably the services that you're providing. I will say for us here in Ohio, we don't have that much demand for it. Rarely do I get asked for it. And it is really one of those things where people don't look back to us all that often for that service. Normally it's, all right, thank you. We used to have an on-staff grief counselor for years and years and years, and we could never get anyone to come back and use it. So I don't know if it's just like, okay, I've got my baggage with the funeral home. They did an awesome job, but I'm going to go seek help somewhere else. That's just been my experience. But I know Canada has it's a whole different level of things that you got to take care of.
Very different what we do here. Do you notify the credit bureaus in the United States? Do you notify the credit bureaus of the death? Because that is, up here in Canada, that is a service that the funeral homes do charge. It is a revenue generating service up here in Canada. Do you do that in the US?
We have the form in our ebook for them to do it. We do not do it for them.
So a family can do it, because here in Canada, it can only come through select yeah, it's more stringent than that. Not everybody can. Okay. Thank you.
Yep, you're welcome.
Good question.
1 to 2 more questions.
I have a quick question. I'm Matthew Fiorillo from New York, White Plains. We're just a few miles north of the Bronx, so we got pretty slammed. And we were doing, like Frank said, services all along. The first COVID case we got, we were blown away that it was actually really happening. And the first one got put in a cremation container at the hospital, taken to the crematory, and was never seen again. And then the next morning, our staff meeting, we said, we're going to give these people back to their families for 1 hour. So we were doing back to back 1 hour visitations. The body would be embalmed and sanitized, and the families were invited to come to the funeral home. My question is, did you see, we saw a downtick in direct dispositions. You know, you tell a New Yorker you can't do something, they all of a sudden want to do it. So we saw a downtick in direct cremations and an uptick in families that wanted to come in and see the deceased. And to my favor, my competitors in a lot of my, 2 of my markets had pop-up windows right on their homepage that said, basically call another funeral home. It's, all we're doing is direct burials and direct cremations. No one's allowed in the building. We don't even meet with you in person. And we were doing the opposite. We right away plug and played our virtual arrangement center. And, but my question again is the long question, but did you see a downtick in the immediate cremations and an uptick in in-house services?
Matt, for us, I guess it's how you classify it. We still, if there's an ID view or private family viewing prior to cremation, we still categorize that as a direct cremation. So did we have a lot more IDs and private family viewings without embalming because they couldn't go to the nursing home or they couldn't go to the hospital? Oh yeah, an order of magnitude. But that generated revenue, but it didn't move that from a direct to a direct with service. At least the way we've categorized things.
Yeah, our direct cremate, we always provide a private family viewing before cremation, and our graveside services shot way up. I'm just curious if you think that might be tied to the fact that people weren't able to be with their loved ones when they died.
Absolutely.
That's exactly what we saw. We had more and more families saying we haven't seen mom in 2 months. So we definitely, even though they may have wanted a direct cremation, they were willing to pay extra for embalming because we did require embalming. Said it was part of the CDC guidelines, and that they recommended embalming for all visitations. So we were doing a lot more embalming than ever before. I mean, I've heard many families who really just wanted a direct cremation.
Yeah.
Frank, you were requiring embalming for everyone or just someone that passed of COVID?
Everyone. Because a lot of our people didn't know, and the medical examiner was coming and doing post-mortem tests, and we had a lot of them coming back positive because testing wasn't as widely available.
Yeah.
We did the same thing. Embalming required for an open casket viewing, no matter who it was, COVID positive or not, and that worked for us as well.
And we probably had 5 or 6 families go from our discount brand to our traditional funeral home because we said we don't offer embalming. If you want to have a visitation, Carmen Funeral Home be happy to help you. And we had several families say, okay.
Yeah, I think I heard from a lot of people, a lot of funeral homes, that they were acting as if every single, body was COVID positive just in case, and kind of going through that motion, which I'm sure it depends on places in the country and all that stuff. But did you guys essentially, almost prepare your staff like every single person was potentially a positive case, or was it really, just based on people you knew came in positive?
That was very different by region.
By region.
That's not a blanket answer. That was so different for Frank and Matthew than it would have been somebody in Idaho.
Yeah.
So totally different by region.
Yeah, that makes sense. Well, we are at the hour. This was so fascinating. Again, you guys have just such incredible perspectives from such different backgrounds, and are really, really industry leaders in this space. So I was just super honored to be able to like sit and listen and learn from all of you guys. We are recording this, so I'm happy to send it out to folks afterwards. And if you did have a question that wasn't answered, yeah, send it to me in an email and I'll forward it on to the panelists, because I know that they are super open and happy to answer all questions from this community. But yeah, round of applause to you guys, because you guys are just incredible. And I mean, you're really on the front lines doing everything to help people right now. So.
Thank you, Katie.
Thank you guys.
Thank you. Yeah, thank you, Katie.
Talk to you later.
Okay.
Thanks, guys. Good to see you all.
Good to see you, Lisa.
Good to see you, Lisa.
Take care. Lisa, great to see you.
Yeah, exactly.
You too, Kevin. I'm standing in for John. He's on vacation.
Ah, there you go.
I know.
Say hello to him for me.
I will. He's over at the lake. He says hi back. Thanks, everybody.
All right, take care.
Bye-bye.
Bye.